guess who controls your destiny? Fans. But you diss them.
Good afternoon, everybody, and welcome to our breakout room. My name is Desiree Joy Frias. I use she, her pronouns, and I'm the campaign director for the People's Bailout. This breakout room is going to have a panel discussion on COVID and the economy. Our organization fights for many different aspects of relief, but today we're going to focus on direct cash payments. You can learn more about the People's Bailout at thepeoplesbailout.org. Sorry about the tech issues. The People's Bailout is a partnership of over 1,000 signatory organizations and lawmakers that have been fighting since the start of the pandemic to pass a just recovery that centers people, not profits. Our 5 principles are health, economic relief directly to people, bailing out workers, not corporations, investing in a green economy, and protecting our democracy. Under these 5 principles, we fight alongside signatory organizations, lawmakers, and individuals for targeted asks such as free and equitable vaccine distribution, recurring cash payments, and Medicare for all. So today in our panel, we're going to be discussing the economic harms that have been caused by the COVID-19 pandemic and the decisions of the Trump administration. The list is long: unemployment, the number of people below the poverty line, medical bills, personal debt, foreclosures, evictions, utility shutoffs, closed small businesses and agricultural production sites, on and on. You know that these economic harms because you're living them, and so are people in my community here in the South Bronx. We're not going to be able to cover all of these economic harms in 30 minutes, so we're just going to focus on direct cash relief as a key fight in 2021. The incoming Biden administration has put forward a $1.9 trillion COVID-19 American Rescue Plan. One of those aspects is going to be an additional $1,400 one-time stimulus check. The issue is that many of us were already struggling financially before March of 2020. The 2008 recovery that moved billions of dollars to banks and mortgage loan companies didn't trickle down to me and my neighbors here in the South Bronx. The intentional harms caused by the Trump administration in the interests of reaching what former Health Secretary Azar called herd immunity cost us millions of lives. We have 72 million people in this country not employed, not retired. These stimulus checks have only totaled $1,800, and that's $5.78 a day since the declaration of the pandemic on March 14th of 2020. And that's if you were able to receive both checks at all. Many of our neighbors were locked out of accessing this financial relief, either due to their migrant status or other factors. So it's clear we need a people's bailout now, and that bailout has to include recurring $2,000 cash payments. And our panelists are going to tell us how we can fight for one together. So I'm going to start with Afua Atta-Mensah. She is the director of Community Voices Heard, New York. Afua, if you can introduce yourself to our community.
Hi, I hope everyone is doing well. I'm so excited to be here today. As Desiree said, my name's Afua Atta-Mensah, and I'm the executive director of Community Voices Heard. We are a base building institution located in the great state of New York, where for the last 26 years, we've been organizing and building powers in low income and working class Black communities, communities of color, and immigrant communities in New York City and in the suburbs up to 2 hours north of the city. And so, as you mentioned, Desiree, clearly New York has been ground zero for COVID, and what happened to our communities across the state has been horrible. And we believe strongly that giving money to people directly to allow them to make the decisions for themselves and their family is the greatest impact that we can have right now.
Thank you, Afua. Next, we have Chioma Oruh. She is a member leader with Spaces in Action and COVID Families. Chioma? Hey, I think everyone is frozen. Chioma, can I hear you now?
Yes, yes. So sorry about that.
No problem. So yeah, just introduce yourself, your organization.
Sure. My name is Chioma Oruh, and I'm here with Spaces in Action, which is a DC-based grassroots organization, and COVID Families, which is a project of Center for Popular Democracy.
Thank you. And our final panelist is Stacey Rutland, the founder of Income Movement.
Hi, thank you so much for having us here, People's Bailout, for inviting so many of us to be part of this conversation and the work that the Frontline is doing and all the partner organizations. Really happy to be here with you guys today. Income Movement is a national organization. We're working to ultimately get a federal universal basic income passed. But as you can imagine with COVID, what we're seeing is an opportunity to start to think about what monthly cash can look like in times of extreme economic crisis. And so we've been working consistently with partners who are doing policy and legislation on the Hill to try to get recurring stimulus checks, monthly stimulus checks built into COVID legislation. We're kind of all hands on deck for that specific effort right now. And we're launching with the inauguration this week, we're launching 100 days of action in the first 100 days of the Biden administration, specifically to help elevate and promote ideas around why cash to people is so important, but also to pressure Congress and our new leadership to make this a priority and make sure that what we're really doing here is exactly what Desiree said at the beginning. We're bailing out people, not corporations, and making sure that everybody can take care of their basic needs during this very, very difficult time.
Thanks, Stacey. So Afua, can you outline some of the changes, economic changes that the individuals you organize with have been facing since the start of the pandemic?
Sure, and thank you for the question, Desiree. I really appreciated how you started the framing about in your community in the South Bronx. And we know specifically in places like the Bronx and in Queens and Yonkers and Newburgh, so many of our members and their family members either lost their jobs or were furloughed or had their hours cut so much that the paltry amount that they were taking home was clearly not going to be enough to sustain their families. And our members and several of their family members who were lucky enough to not lose their jobs often were frontline workers where they had to make the grueling decision every day about whether they go to work to help others while possibly putting their families in jeopardy when they came home. And although there's been a lot of rhetoric about being essential workers, we know there was nothing essential about that pay. So what we've seen is nothing less than devastation. So many small businesses throughout the city closing, restaurants, all the things that I think make New York such a great area are holding on by the wayside. And we know that as the jobs close up, the businesses close up, the jobs disappear. And it's going to be hard to be able to go back when this is over. But equally important, as you said, Desiree, so many of us were catching hell pre-COVID, right? So this is just an insult to what was already happening. So severe devastation in regards to lack of income and all the ripple effects around that, being able to pay for housing and electricity and childcare. So it's been a really hard time.
Absolutely. And Chioma, I know you organize with families with disabilities and also now with families who have lost family members due to COVID. Can you talk a little bit about the economic impact of COVID in your community?
Sure. I'm from Washington, D.C., so sorry I didn't say that first. I can start within my family and tie that to the greater community. Like I think as Afua rightly said, like a lot of us are, life was already tough pre-COVID. Things were already, systems failures were already evident, and present in life. So crisis was pre-COVID. And for me, I I'm a mother, I'm a daughter, I'm a sister, and so I support families navigating through the systems of care because I was already dealing with pre-existing issues. My children have autism. My dad, unfortunately, who died of COVID in May 2020, was a survivor. He had stroke, he survived a stroke, he survived cancer, had dementia, and was already kind of prone to the, healthcare systems. And unfortunately, COVID was the one battle he couldn't beat. And he left us in May 2020. And so that has propelled just a whole heap of different levels of trauma, and crisis, economic crisis. My parents were first generation American, were Nigerian by origin. And so my parents, do not understand the system, did not understand navigating it as parents of kids. My older brother had schizophrenia, navigating the system from there. And then even when they started aging, we all are figuring out what it means to live and age and grow in the United States. So, right now I'm trying to save my mom's house, because, she's aged and so has my dad. And, my dad was aging and sick. So there was already pre-existing economic stress and that impacts my family. So for me, my answer has always been to activate and advocate. And so what I have been doing politically, just as a mom and as a caretaker in general, has been locally to engage the systems of care and doing that work. That work seems to be so much more prominent and front and center for other people now who may not have been navigating the chaos of the healthcare system as intimately as I have with, families with very deep need for support within functional systems. So I'm seeing other people tuning into things because everyone's now spiraled into crisis. But, we have been living hard already, and even harder now. So it's just exacerbated and deepening of existing, conditions.
Absolutely. I pointed out a little bit in my intro about, the 2008 fiscal crisis, but for many in my community, things have just always been hard. And what COVID did was that it exacerbated and deepened the inequalities between us in so many ways. And Stacy, as someone who has been organizing with income movements since before the pandemic, how has the pandemic brought people to your organization with new stories?
Well, I think that certainly one of the key results of COVID is that it has plunged a whole new group of people into poverty that maybe haven't experienced it either ever or haven't experienced it for many years and are subject to the broken systems that are supposed to be there to help support those who find themselves in that situation. And so I think one thing that has been really profound in the movement for basic income is just how many more people are open to and recognize the importance of giving cash to people. That there's lots of programs out there. We could probably have a multi-hour conversation about the problems with our social insurance system right now, but starting to think about the importance of just giving dignity and autonomy to people through cash to be able to make the decisions that they need to take care of themselves and their family has become a rallying cry for a lot of people who didn't have to ever really think about it before. With COVID, I think, we saw with the first $1,200 check that was part of the CARES Act, we saw 4 million people lifted out of poverty from that one check, which is, when you think about those numbers, that's pretty profound. What we also found was by not having additional support in the coming months after that, 8 million people went back down under the poverty line. And so for a lot of what we are hearing in particular, and with I think I was listening to the Frontline show before we did the breakout sessions, and referencing that the December numbers of 140,000 people losing jobs, and it was all women, significantly women of color, and the very difficult situation that so many women find themselves in right now, of trying to figure out how to take care of children at home, who are trying to school at home, trying to keep, food on the table, all of those things. It certainly has kind of exacerbated and compounded the struggle, the day-to-day struggle for millions of people.
Absolutely.
So, yeah.
And Afua, we just to go off of that piece on the first stimulus check, Afua, when that first $1,200 stimulus check hit in spring of last year, how did that impact your community?
So I'd say, to Stacy's point, it was a start to allow folks to move from the immediate disaster, but not nearly enough for what it takes to, if you're right, I'm a mom, Chioma mentioned, I am, hiding in a room from my kids right now. So if you're in a household that's not just yourself, the 1,200 was a start from nothing, but it wasn't enough to stabilize, right? And I think we're all agreed that we want to move from this just surviving to being able to thrive. And then, I have to lift up that our undocumented brothers and sisters are the excluded workers, right, who are not getting any of those cash payments. So there, even though that was at a start and an important start, I think our gold star has to be a higher amount, an ongoing amount that is put in everyone's hand, because we're all in different levels and stages of crisis throughout this. And to your point, we can, there's a host of problems that are metastasizing because of this lack of money. And definitely there's a disparate gender impact of how it's affecting women, particularly Black, Indigenous, and women of color. And I'd say we were dealing with double burdens before, but triple burdens of homeschooling, working, and the whole trying to keep your sanity piece. And that some of those monies could go a long way for many of us who are in that struggle.
And yeah, absolutely. And Chioma, with COVID families, in your organizing in that group, have you seen a lot of medical debt or other expenses directly tied to the COVID-19 crisis?
Yeah, I mean, I just want to appreciate the summation by Afua and Stacy, the conditions. We, again, are just a network of people coming together, in support of a very serious moment in our lives, knowing that a lot of the debts that we're facing are preventable, but we are not technically, we're a very diverse group of people that have come together. I've already had pre-experience with this. I mean, I'm a parent of children with autism, so I understand how something like how a condition or a situation or phenomenon like COVID or any kind of condition that people are facing can bring unlikely allies together. And we find ourselves in this place. So intersectionally, again, I already in my local community can observe and can see like how COVID is impacting the Black community specifically, right? Like, and what I've seen and what some other moms that I'm connected to, other moms of kids with disabilities who are really, suffering in silence right now. And there aren't a lot of solutions educationally. But when it comes to the healthcare cost aspect of, COVID recovery, or, after the death of a loved one, you can't sue right now. That's one big thing we're talking about in COVID families. Like, I can say that my dad had a pre-existing condition. He was failed by the system because he was in a nursing home that was not taking precautions. So they killed my father, in fact. But because of the way COVID kind of manifests right now, one cannot take on wrongful death. And so many people are in similar positions, right? Not quite knowing how to make sense out of everything, including, pre-existing failures of navigating the systems. He was a person with dementia. So, while they could have given some accommodations to allow, he died alone, right? I saw my dad die on Zoom. And so many of us were in similar positions. And this is a man that I knew he wasn't feeding well. They were even thinking of putting G-tubes because, his mental state was at a space where he couldn't have even helped some of the other things that would have maybe let him fight with the winning battle. But it was hard to even get that support before he got COVID, because he didn't end up in a nursing home because he had COVID. He was in a nursing home because he had One, he was hospitalized for an infection. Then he was fighting for his life in February in the ICU. He had aspiration pneumonia. And that's what, after he was recovering from there, they didn't want to release him back in the home because he wasn't feeding. He needed feeding therapy. He needed occupational therapy. He needed speech therapy. He needed physical therapy. And all those therapies, the home was not a ready space for that. So that's how he even ended up in a nursing home in the very first place. We see these stories reiterated, right? As some people in the community may have just gotten sick and they were, typically developing and no pre-existing conditions prior. But for those of us that were aging, that had disabilities, like it's really awful. And what does ADA mean, as in the Americans Disabilities Act, mean today when it comes to COVID? I mean, some people are starting to be able to be with their loved ones when they're sick and dying. But at that time in May, there was no accommodations. My dad was afraid and not aware, and he died completely alone, right? And that has to have a cost to it. Somebody has to account for that. In addition to just the what happens when you lose somebody who was bringing income up until the point he had dementia, which was already pre-existing and bad. What happens when you lose a source of key income to be able to sustain a family? And we're seeing that happen on different levels with different people, and we come together to think and talk and feel and hopefully find a way to find a political platform to our pain.
Absolutely. And I think that the failures at the federal government, in the federal government's decision-making around the pandemic, it's hard to start even thinking about accountability when we are still struggling with the pandemic. But I know that there has to be some kind of accountability. There has to be a way to address the trauma that's been faced in this country. But I think that a good point to start on is to focus on how we can provide direct relief to people. And it's got to be cash in hand. It has to be additional checks. People need the money right now. They don't need a promise for the future. And I do want to give people a moment to ask any questions. There's a chat box on the event platform if you want to ask the panelists anything on the right-hand side. But in the meantime, Afua, is there anything else that you'd like to add to this discussion about cash relief?
No, I mean, I want to give some space for Stacy as well, but want to just take a moment because of I was just so moved by Chioma, and just want to extend deepest sympathies. And so many of us have lost people or had friends or coworkers. And I just want to take a moment to lift up a longtime Community Voices Heard member who we lost last week due to COVID, Roxanne Reed.
I think it's hard to, it's hard to talk about money in the midst of all of the pain. I think it's such a core part of how we could give some space to each other. We just had a conversation last night with some really just strong, amazing women. We had an event that's for leading into MLK Day, because he was a proponent for guaranteed income. There were some events happening, and we were talking with Aisha Nyandoro, who leads Springboard to Opportunities in Jackson, Mississippi, and she was talking about cash, and what she talked about when she talked about it was that it's an opportunity, it provides bandwidth to people. And it was a really interesting and important way to talk about what cash does. It gives space for people to focus on what's happening in their lives. So much of our mental bandwidth right now is taken up by how do we pay our bills? How do we feed our kids? How do we not get on, end up on the streets? How do we make sure that that we can be in touch and in contact with our family members who are having health issues? My mom was diagnosed with lung cancer in the middle of this, and we weren't able to be part of any of her process at all. Like, how do you provide space for us as a nation, us as individuals, to process that, to heal from it, to come together in community? And cash provides an opportunity to do that. It really does. And I think that it's an important piece that we just don't talk about enough, that there's rent, there's food, there's these things. And there's also just mental space to try to process what's happening right now to our families and to ourselves. And that's such a core fundamental, I think, right to have some kind of
Stability.
Our own mental health right now.
Yeah, no, I mean, part of the issue is that we've been, people have been so insecure by this pandemic since March of last year, with no respite. That $1,200 check came in, then another $600. But for me and many of my neighbors, that money was gone by the time it got here. It went to the landlords, it went to, Con Edison, it was already spent. And it is hard because so many community members have been addressing each other's needs through mutual aid, through other tactics. But there's no, I can't conduct mutual aid with Con Edison. They won't take it. They need cash. And exactly. Lawmakers have to understand that the majority of Americans did not have a savings account before this. We're already living paycheck to paycheck, could not handle a $400 emergency charge. So this pandemic is just, it's been too much. And I think that the push has to be to continue to provide real relief. So one of the questions was, how would Medicare for All provide relief from this pandemic?
Yeah, I'd love to touch on that, and also touch on the point around Medicaid, sorry. I mean, so I think that both Medicare and Medicaid, these are laws that came at a time where protections were clear and needed, particularly for vulnerable populations, people with disabilities, low-income mothers, and the like. And so we have to look at the root of the law. But I totally agree that we have been past a point, and COVID wasn't the trigger, right? Like, as we've said over and over again, we've been past the point where we should not require means testing in order to prove the failures of the economic system that, has nothing but pain, but for everybody. So in terms of healthcare, if we're not going to means test, economically, I shouldn't have to prove my value to be sponsored by the state in order to receive just services. And even when you have these programs, there's recertification that with Medicaid right now, but it is a superior healthcare structure. If we can recognize and really remove the means testing, same way we want universal basic income, I shouldn't have to prove that I'm poor in order to meet qualifications for economic support, because the system truly is hard for a huge population of people that may never be eligible based on the current definition of what poor is, or what sick is, or what, who needs help, right? I mean, the survival of the fittest mentality never worked, right? Like, that whole scarcity model is really defunct, and it's harming and hurting people. So I think there is a place to talk about the economy. Healthcare comes at a cost. Me, as a parent of kids with disabilities that had to prove my kids' value and worth in order to be able to get the therapies I needed, blood, sweat, and tears, loss of employment, that crisis hit me before COVID, right? And so knowing that more people, as we've said, more people are in this process, and are in this process of figuring out what happens when you have to adjust to life, right? Where ability should not be, a question of what you do and how you function, and if you are worthy of receiving support economically or healthcare. I think Medicare for All is a basic ask. It's a simple ask, as is economic relief.
Absolutely. Any last minute closing thoughts from the other panelists? We only have a minute or so before this panel closes out.
Want to again lift up to be so glad to be sharing space with you all today, and really excited that this panel was held and that we had this event today.
Yes, thanks everybody. This has been really great. And I think these are the conversations that we need to be having, and, you know, and to get inspired by each other, to keep doing the work, to keep, you know, providing opportunities for our communities to take their voice to leaders, to start doing the right thing, I think is just so critical. So feeling very, very thankful to be here and very inspired by everyone, all these awesome women.
Yeah, I just want to also reiterate that I'm really grateful to be in this space. I know it's important that, you know, we sign the people bailout letter. I mean, I feel like it's not even necessarily bailing people out. It's just doing what's right. These are human rights values. And I feel that, you know, that's just the basic thing. And I'm just really grateful to have the opportunity to share it. This is part of my healing process. And I'm just, you know, thank you all.
Thank you all for being here.
Rude, you won't get far, cause a turning you quick, you drop like a